Asthma is a chronic inflammatory disease of the airways that is usually reversible. Exposure to an allergen or irritant leads to airway hyperresponsiveness. Your body reacts by initiating an inflammatory response. It begins when certain cells, called mast cells, are activated to release histamine and other inflammatory mediators, causing congestion, fluid formation, thick mucus production, and muscle tightening and spasms of the airways. The inflammation and narrowing of the airways may occur and bring on symptoms quickly, within 30 to 60 minutes, called the early phase response, or symptoms can recur 5 to 6 hours to several days later with worsening symptoms called the late phase response. With appropriate treatment, progression of asthma may be prevented. If asthma is untreated over time, remodeling or structural changes can occur and lead to permanent damage to the lungs. Asthma affects an estimated 22 million Americans of all ages. Among children, more boys have asthma, but among adults, 30% more women have asthma than men. It is not clear whether or how gender or hormones play a role in causing asthma. The asthma prevalent rates are 39% higher in African Americans than in whites. Although mortality rates from asthma have decreased, there are over 4,000 deaths per year from asthma. Asthma affects all aspects of life, like school attendance, occupational choices, and physical activity.
So it appears as if Sylvia is experiencing an asthma attack. Some risk factors or triggers that may have started her asthma attack include the following: allergens, dust, pet dander, maybe she's allergic to certain pollens or plants. Exercise, was she exercising, was she running, hiking, or biking? Does she have a previous respiratory infection? Does she have bronchitis, pneumonia, sinusitis? Any food or drug allergies? Did she ingest anything with sulfites, ingest beer, wine, dried fruit, or shrimp? GERD, maybe she has a previous history of GERD. It's thought that the reflux of the stomach acid into the esophagus can be aspirated into the lungs, which causes the bronchoconstriction. So if she has a previous history of GERD, this might play an important factor. Stress, crying, laughing, anger, fear can all lead to hyperventilation, which can cause airway narrowing. Some signs and symptoms that Sylvia may be experiencing with her asthma attack: it can have a gradual or abrupt onset. Wheezing may or may not be heard with an asthma attack. No wheezing is not a good sign, as it means there's no air exchange. Breathlessness, patient or Sylvia might feel like she's not able to breathe or catch her breath. Chest tightness, a feeling of suffocation, and coughing that produces mucus. And if Sylvia's asthma attack continues, she's going to become very fatigued.
Medications for asthma are broken down into two groups based on how they treat the asthma. We have short-acting or quick relief. These include bronchodilators, which means the medication helps open up your airway by reducing inflammation or swelling brought on by the asthma. Examples include albuterol and Atrovent. There is also long-term medications that are used more as a prevention mechanism. These medications also help reduce the late-phase swelling or inflammation that may occur or block the chemical receptors that may be activated in the late stages of the asthma attack. Examples include Asthmacort, Solumedrol, Singulair, or Ental. This is a long-acting. Asthma medications can be inhaled, taken orally, or given by an IV. Okay, Sylvia is currently having an asthma attack. The best thing for her is a rescue inhaler. Here I have albuterol sulfate. You need to shake well, and you put it into this aero chamber here, and this allows for adequate inhalation. And she will blow through, take 2 puffs, hold her breath with each puff, and release when she can't hold it anymore. Wait about a minute in between each puff.
Okay, Sylvia, I'm going to talk to you about some ways to prevent asthma flare-ups. It's very important that you take your medication as prescribed to continually reduce any inflammation in your airway. You will be given a peak flow meter, which you will use every morning for the first week. You'll take your findings and you'll record it so you know your personal best. Knowing your personal best allows you to predict when you may be at risk for an attack. You will also have a maintenance inhaler, which is for prevention, so you use that even if you're not having an attack, even if you don't feel sick. With that, you will also be given an albuterol inhaler, which is known as a rescue inhaler. That's for use only during an acute attack. You should have allergy testing done in order to prevent asthma attacks due to allergen exposure such as mold, smoke, or pollen. Finally, you should eat small frequent meals to prevent any pressure on your diaphragm, which can cause an asthma flare-up.
Thank you for watching our presentation on asthma. Our group consists of Laura, Brittany, Ashley, Erica, and Sylvia.